Good afternoon, everyone. Greetings from Forts. We welcome all the participants to this public awareness webinar on men's health, a much needed topic in today's pandemic situation. We thank Rotary Club of Adyar and Chennai Specialty Clinic for giving us an opportunity for conducting this webinar for the general public. Forts is in the pharma industry for the past 40 years, following the motto of innovating for good health. We from Forts have innovative products in men's health like Mildfill, Uphold, Tamfill, and UBQ. At present, we are exporting our products to over 50 countries around the world. It is our pride to welcome Dr. Ragavan sir, today's speaker. He is a senior consultant urological surgeon and uro-oncologist from Apollo Hospitals, Chennai. Dr. N. Ragavan got trained and worked as a consultant urologist and uro-oncologist in United Kingdom. He did his fellowship in Germany. He has 15 years of working experience in uro-oncology with expertise in open laparoscopy and robotic surgeries for patients with prostate, bladder, kidney, penile, and testicular cancer. He was first in South India to perform novel and pioneering works in robotics. Dr. N. Ragavan is a keen academician, researcher, and a trainer. Dr. Ragavan has published 35 papers in international journals. He is a member and faculty in national and international urology and uro-oncology societies. With this short introduction, I hand over the session to Dr. Ragavan for further proceedings.
Good afternoon, sir. Thank you, Nagashankar sir, for the very kind introduction. It is an amazing opportunity to be in front of esteemed crowd, and I thank Forts for providing this platform for us to do this initiative. On behalf of Rotary Club of Adyar and Chennai Specialty Clinic Health Foundation, we are conducting a series of public awareness initiative talks, inviting public and professionals to join in as our measure towards improving the awareness of the public in the key areas, especially the non-communicable disease area. To this end, the first talk in this is men's health. It coincides well with the Prostate Cancer Awareness Month that is happening this month as well. Let me start my presentation. Can all of you see the screen?
Yes, sir.
Okay. So men's health, why is it important? Because men form half of the world's population, and without men, women, and the whole population cannot exist. It is as important as the initiative that we take about the women's health as well. Hopefully next month we will talk about the women's health as well. All human beings have heart, lungs, and therefore things related to every human being that goes as well. But there are things which are specifically meant for men's problem, and therefore we thought we should start an initiative to make this an important thing as well. The aim of the talk is to make people understand the common disorders relevant to men's health. The topic that would be covered is urinary tract symptoms, because this is the most commonly affected men's problem: prostatitis, erectile dysfunction, urinary stones, and cancers relevant to men's health. So both the gender have kidneys which are located in the back of the human body, which drains the tubes, the urine from the kidney into the bladder through tubes called ureters. In men, what is so special is that the urine tubes comes into a place called urethra, but after that it comes out straight into the outside in women with a short urethra. In men, there is something called prostate gland, which is situated below the bladder. The urethra, the urine pipe, goes through the prostate, comes out, and comes outside the body. So exceptionally relevant to this is the prostate gland, the penile and testicular, or what we call genitourinary system itself. Lower urinary tract symptoms, or what we call LUTS, is the common terminology. In olden days, people used to call it prostatism, but lower urinary tract symptoms is the terminology that is accepted by the world medical community now. Weak urinary flow, hesitancy, that is difficulty to start urination, Intermittency, that is, it starts and stops and starts and stops again. Terminal dribbling, that is, it dribbles 1 or 2 drops after finishing a passing urine. A sense of incomplete emptying. Frequency, that is, going often to pass urine both in the day and in the night, called nocturia. Urgency, that is, going to pass urine in an urgent fashion, and if you can't do that, you leak urine as well, and sometimes burning sensation in the urine. All these together forms lower urinary tract symptoms. Any patient who presents with these symptoms, the doctor will examine the tummy as well as examine the prostate gland through the motion passage and do any other tests that are required to be done in order to achieve a diagnosis, such as blood, urine test, a Euroflow test, ultrasound scan, scopy, biopsy, and whatever. So all these are optional tests. They are not done on a routine basis. Only if we have any concerns, we do all these tests. Otherwise, if the patient has a straightforward problem, they go into tablets called tamsulosin, which primarily allows the prostate to relax and allow the flow to happen better. Sometimes we add something called pelvic floor exercises as well, so that the control of urination is much better. Very rarely, endoscopic surgery using camera is done in order to improve the flow of urine for men. Now, I just have to, before we move on, I just need to put things in perspective as why I spoke about this. Let us assume 100 men are there at the age of 60. Almost 60%, that is 60 out of 100, will report urinary problems. And out of the 60, at least anytime between 2 to 10 people may even have a cancer in the prostate as well. So it is a very, very significant and common problem. If you close your eyes and think, you would have noticed that your father is getting up and going to pass urine 3-4 times in the night. Your granddad is doing it, or you are in the age of 50, you might as well have started to go to pass urine often. You feel the stream is slow. So men going through this problem is like almost near 100% by the time the men touches 80 years old. And if you take the cancer alone from the prostate, which I'm going to discuss later, that also forms an important component to it. And therefore, if you have symptoms relevant to urinary tract, it is very important to meet a local doctor, either a GP or a urologist, and get it checked out. Next is chronic prostatitis or chronic pelvic pain syndrome. Now, one of the things that has transformed in India in the last 20 years is that IT industry has, phenomenally expanded in India. I live in Chennai in a place called ECR, and very close to me is a place called OMR. And the OMR has the whole IT corridor there. Roughly about 50-60,000 people work there in the corridor, or I would say roughly 1 lakh even work there, out of which at least 50% of them are men. In the last 20 years, all of us, all the urologists have noticed that the incidence of this problem, chronic prostatitis, has significantly increased. Now let us understand what this is. Now, chronic prostatitis is not a simple single diagnosis. It is a combination of many little problems: mild nagging pain, mild burning sensation during or after passing urine, post-ejaculatory pain, low-grade fever, low backache, perineal pain. Many of these things are irritating but not life-threatening. The chronic prostatitis will not kill the patient, but they will have an impact on the quality of life. Who are susceptible? People who sit for a long time, IT people, shopkeepers, drivers, people who have poor ejaculatory frequency. It was very famous and tested in the prison convicts in Australia, from where we started to understand that it is common to have this problem when you don't ejaculate often. But I have also seen very often that the IT corridor people, IT professionals, do have poor ejaculatory frequency because of a very long work schedule that they have, 18-20 hours of work a day. Poor water intake. Because you sit in AC room, you feel there is no need to drink water. But if you are not drinking adequate water, you end up with a urinary infection or a prostatic infection. What tests should be done for these patients? I mean, this is a diagnosis of clinical suspicion. However, we tend to do tests such as urine culture, a semen culture, ultrasound scan, Euroflow, a blood test, in order to make sure we are not missing something else. And the majority of the patients are treated with medical therapy. I would say, a rough estimate, about 7 out of 10 patients get better after a good treatment. 2 out of 10 patients get better, but they have a relapse later. 1 out of 10 patients may not get better and they may require more treatment in future. And in terms of generic advice, good water intake, good ejaculatory frequency, and avoid prolonged sitting. Every hour, make sure you get up, walk around the place, have a cup of water and sit back. And a good ejaculatory frequency is something like this. From the age group between 25 and 35, at least 3 times a week. 35 to 45 is about 2 times a week. 45 to 55 is 1 to 2 times in 15 days. 55 to 65 is about once a month. And by about 65, a reasonable majority will find that they have erectile dysfunction. That takes us to the next topic, which is erectile dysfunction. Why is this important? It's very important. Mental health, physical health, sexual health, all are a combination of things for overall well-being for any men, and for that matter any women as well. Generally, erectile dysfunction can be divided into 2 things. One is called psychogenic erectile dysfunction and other is organic erectile dysfunction. Psychogenic erectile dysfunction is sudden and situational. It's associated with the presence of nocturnal or early morning erections. Whereas organic erectile dysfunction is gradual in onset, affects the non-coital erections, and it is there in all circumstances, not situational in any way. Any patient, let us say a 45-year-old walks in and says, "Doctor, I'm just finding my erections not good," then immediately my mind should start working on this direction. I should make sure that I'm not missing diabetes, dyslipidemia, lipid problems, you see, on any drugs, alcohol intake, trauma, neurological illness, endocrine illness, depression, smoking, extremely important cause, smoking. And sometimes the hypertensive medication can cause erectile dysfunction as well. We tend to do a baseline test like fasting glucose, fasting lipids, hormones, prolactin, ECG, and cardiovascular assessment if necessary. And the first advice I give them is modify the risk factor. If you're a smoker, don't smoke. If you have diabetes, make sure your control of diabetes is good. If you are hypertensive and are some tablets, consult with your doctor and see whether alteration of tablets could be done. The next step is to counsel and educate the patient. Third step is to consider what we call oral agents, very famously declared as Viagra. Nowadays, a better drug is called Tadalafil, which is given at a low dose of 5 milligrams once a day, commonly sold as Mildafil. And with these tablets, the majority of the patients are looked after. Very, very rarely, the patients will require local treatment or even a surgical treatment. Now, compared to the late 80s to where we are today, the number of surgical intervention we do for these patients have dropped down phenomenally. Any patient is asked to do a risk factor modification that includes hypertension, diabetes, obesity, stop smoking, hyperlipidemia, and hypogonadism. The next thing which I want to touch upon is called premature ejaculation. Very commonly found in our clinics. So patients will say, "Doctor, I'm not able to perform well on the bed and I ejaculate very quickly." Then you ask a question, what is the time you take to ejaculate? So anybody, when they start a penetrative intercourse, They can ejaculate between 30 seconds and 1.5 minutes. So a premature ejaculation is something which happens less than 30 seconds. In these patients, the first thing we need to address is expectation and reality. Thanks to internet, YouTube, pornography, there are a lot of expectations in men and women when it comes to the sexual function. So therefore, as a doctor, one of the jobs for us is to unpick these things and make them understand that what you see in a YouTube or a pornography is shot over the last 20, 30 days, not in a one stroke, and make them understand the depth of the problem so that we bring the expectations to the close to the reality. A very uncommon, but some patients will require drug therapy as well. Stones in the urinary tract. Why did I put it in men's health? Because stones in the urinary tract is far more common in men compared to women. It's called urolithiasis. The telltale test for this is a CT scan. CT scan plain or an ultrasound scan. I prefer a CT scan, a blood test and urine test. And the treatment is water, 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 water. At least 3 liters of water a day. Milk is 2 cups a day. Strictly no to chocolate, soft drinks, juices, and very limited amount of spinach, cabbage, and meat. Now, people who have small stone, 5 mm, 4 mm, the vast majority will pass the stone. Very, very rarely, they need an endoscopic procedure to break the stone and clear it. Having said that, stones above 6 mm, especially above 8 mm, the probability of that stone coming out is very, very low, and therefore it will be better to intervene those patients as well. Urinary tract infection. Now, I'm going to not take a shock break, but I just going to need some water to talk. So I'm going to pause the presentation for about 5 seconds and join you one more time. Okay. Now, sorry, urinary tract infection, I put a women's picture here. The reason why I put in men's health topic is that it is important to make sure your women in the house are looked after, be it your mom or your wife or your sister. Now, this is a very common problem in women, less common in men. In men, it is inevitably related to either stones or not emptying a bladder well. But in women, it's very common to find it. Sorry. Many people get confused about urinary tract infection. Oh, it is, I have a UTI, doctor, because the urine culture is positive. No, urine culture being positive is very common in women, diabetics, sometimes in pregnancy as well. So do not get confused with a positive urine culture as urinary infection. Urinary infection includes a concoction of symptoms: dysuria, frequency, urgency, fever, with or without growth in the urine. And a very telltale sign is the presence of a huge colony count in the urination, but this is not dogmatic. The most common causative organism is called E. coli, and they form the majority of the UTIs. And the treatment is very simple: water, perineal hygiene, empty the bladder before and after intercourse, medical therapy, exceptionally rarely surgical intervention when there is a reason, for example an infected stone we need to clear, and lastly offset any issues which causes the urinary tract infection. All right, we'll go to the next slide. I'm going to touch upon the next topic called incontinence, very uncommon in men, but exceptionally common in women. Once again, it is our duty to make sure the women in the house are looked after. So just 2 slides on that. It's called urge and stress incontinence as two separate entities, and a mixed incontinence. In men, they have a condition called overflow incontinence. Uh, Stress incontinence is when you leak before you cough or sneeze, when you cough or sneeze. In these patients, make sure there is no other cause causing this problem. And for urge incontinence, you treat the patient with tablets, very rarely Botox or other treatment. For stress incontinence, pelvic floor exercises, and very, very rarely a small procedure. Now, this is the very important topic I'm going to touch upon, called Uro-Oncology, which is primarily looking after the cancers in the urinary tract, especially relevant to the men's health. Prostate cancer is the most common cancer amongst men, more aggressive in Afro-Caribbean population. However, what I am noticing in Indian population is that Indians get prostate cancer less common compared to the West, but when they get it very aggressive. Early stages, the treatment is curative. You can cure the people. Later stages, we still can treat them well, give them a long life. The test that is used to pick it up is called prostate specific antigen. It's a blood test. It is done to understand whether the prostate is having any affection. Therefore, it can elevate in other conditions such as infection, sexual activity, retention of urine, catheterization, etc. as well. Now, what to do with prostate cancer? My advice to men is that if you're above 40, do a master health checkup to look after your whole health, but that includes a PSA test as well. If you're above 50, I'm going to say I will force you to do it. If you're above 60, I'm going to say to you is, why didn't you do it now by now? So PSA is one test which is something is very important for men above 40. Do not hesitate to do it and takes appropriate action, because early diagnosis means we potentially cure patients. Penile cancer, very uncommon cancer, elderly population, lump in the penis. What happens is that they ignore it. They say it's all right, and then they come to us only when they have an advanced disease. Testicular cancer, extremely common in the age group less than 30 or 40. Lump in the testis, majority are at early stages and are cured. Even in advanced stages, excellent treatment with surgery and chemotherapy results in cure in a good number of patients. The next thing I'm going to touch upon is, before I do this, I want to tell something called genital self-examination, GSC. That includes two things: penile self-examination, testicular self-examination, PSC and TSC. So what is this? You examine yourself every 3 months in a shower so that you feel your testis, your penis, to make sure there are no lumps there in that. This is a simple intervention that will save people's life. It's the same concept as breast self-examination in women. It saves lives. So therefore, I'm going to insist that all of you on the 1st of January, 1st of April, like that, first day of the month, do the self-examination as well. Next thing I want to touch upon is blood in the urine, which is called hematuria. Now, lot of people, வயசானவங்க சொல்லுவாங்க, ஓ blood சூடு பிடிச்சிருக்கு, நான் கொஞ்சம் பீட்ரூட் சாப்பிட்டேன், இதெல்லாம். Blood in the urine needs investigation. If I have 100 people with blood in the urine, 40 of them will have a problem, out of which 20 will have cancers. So we have a serious issue here. Blood in the urine always needs help. Two important tests needs to be done. One is a CT scan, other is a camera examination of the bladder. So take home message, ladies and gentlemen who have been seeing this program: awareness, early intervention, self-examination, smoking. Smoking is one of the most important risk for prostate cancer, penile cancer, bladder cancer, and kidney cancer. So definitely no smoking. Be aware, be positive. I thank folks to helping us to the platform and the support. Nagashankar and team had done a grand job. I thank Rotarian Veeramani sir. Thank you so much, sir. It's absolute pleasure and honor to be here. Happy to take questions.
Yes, sir. Thank you so much, sir. In fact, you covered up everything in a beautiful manner, because many times, these are a lot of private things people, forget to do the self-examination and all. You have opened that up, so that will be good. And there are a few questions which has come up, sir.
Sure.
Like the first question is, sir, I just wanted to know, whenever I sneeze, I leak urine. I am 30 years old and I am diabetic.
I'm so happy that this question has come. In the men's talk, I covered this topic as well, even though this is a very common problem in women. So most likely the question has been raised either by a woman or a caring husband. First and foremost, my most sincere appreciation. That this is described as stress urinary incontinence. Most likely it's seen after childbirth. The first thing you need to do is meet a local physiotherapist and start pelvic floor exercises. After doing 3 months of pelvic floor exercises, if things have not improved, then you need to contact a urologist, or you better to contact a Uro-Gynecologist. In the Chennai Specialty Clinic, we have Dr. Meera Ragavan, or any Uro-Gynecologist who is close to your house. But before that, pelvic floor exercises for 3 months, which itself will improve the situation in the vast majority.
Okay, sir. There is another question. Dear doctor, any advice on men's health during COVID-19?
Lots of water. The reason is, in the COVID situation, you don't want to go to the hospital. The common reason that people go to hospital in this month is stones. What do you want to do for the stones? Water, 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 water. I said it 4 because 4 liters water. All right. So water is something you need to take. Having said that, I also want to insist upon another fact. Just because you have a COVID doesn't mean that you sit in the house if you find blood in the urine. As I said, blood in the urine, 20% chance that there is a cancer, and I don't want you to miss it. So my advice for COVID timing is, do things to avoid coming to the hospital, but when there is a need to come to the hospital, do not hesitate to come. I very jokingly say, diabetes or cancer, coronary, and sugars doesn't wait for any corona. It will happen, and therefore do not hesitate to go to the hospital if you have any of these problems. On the other hand, if you want to discuss about an erectile problem and you want to go after the COVID is done, perfectly legitimate. That's fine.
So there is another question. How long depoxetin remains in the body, and what is the effect of tadalafil and depoxetin?
Depoxetin remains in the body for 24 to 36 hours. Just 1 second. Depoxetin remains for 24 to 36 hours in the body. Now, it is best taken almost 2 hours before the planned intercourse. Same way with miltefil, or what the tadalafil 5 milligram, the length of the presence is about 24 to 36 hours. There is a huge change in the concept of management of ED in the last 10 years. It started in 2005-6 when tadalafil got introduced in the West, called Cialis. Previously, we used to give 20 milligram dosing, and one of the studies which came, European studies, showed very much that by taking a 5 milligram daily dosing, we get the same effect as 20 milligram dosing on demand basis. The advantage that the 5 milligram low dosing gave is the freedom of performance. You are not planning your event, or you are not planning your day. So it gave the same result, but at a more convenient time of convenience of the patient and the partner. So over the last 10 years, the transformation has happened now. Tadalafil 5 milligram is the standard of care for erectile dysfunction.
Sir, so next is totally how much quantity of water we should be taking per day?
Assuming you are not a kidney failure or a heart failure patient, my advice is 3 liters a day.
So another is age is 32, patient with diabetes. What should be the precautions for family planning?
I don't understand the question. Family
Question is,
planning,
I think probably, I don't know.
you want a child or you don't want a child? I don't understand. But I'll tell the question for both. Diabetic 32 years old. If you are a diabetic and 32-year-old, you better have your children sorted out now. The fertility of men and women starts to drop after the age of 30. You will find that more often above 30, you start seeing abnormal abnormal semen analysis results like teratospermia, oligospermia, and things like that. In women, the ovulation starts to come down. So the best age to childbear for women is about 25 years, and for men is about 28 years. So if you are planning to have a child, immediately get it done. On the other hand, if you plan to stop children, like do a family planning operation itself, then there is no precaution. You can have it done at any time you want.
So another is again the same question, water intake, that we have already answered. RO water or normal water, is there any difference or advice you will give?
Sir, RO water, normal water is something as a patient you choose. The only advice I will give you is, if you are living in a place which has hard water, like Gujarat, then the hard water itself causes a lot of stone formation. But in Chennai, where I live in ECR, we don't have a problem with hard water. Whether I put a RO or take it directly and drink it, nothing happens. So that is a convenience. If you have a hard water, you will form stones, and hence make sure you have some form of filter for that.
The next question is for prostatitis. TURP intervention used to be very cumbersome. Has any recent development happened in this procedure?
Sir, prostatitis TURP is cumbersome for the patient and the doctor. In my humble opinion, you should avoid doing that operation for prostatitis patient, because the prostatitis itself is an inflammatory condition. After the TURP, two things happen. It sets up an intense inflammation in the prostate. Second thing, it causes fibrosis, and the prostatic ducts get sealed up, and therefore the prostatic secretion stays back in the prostate. So I will advise that if you are having a prostatitis patient and a bladder outflow obstruction, avoid surgery if possible, use tamsulosin, and advise surgery only when you are desperate and there are no other choice. And even then, you just need to counsel the patient so well that it is important the patient to understand that you are on a long haul flight, you cannot get quick answers and quick fixes. It doesn't happen that way.
The next question is, dear doctor, I am having burning while driving and passing urine. It's burning and paining. So how to avoid this?
The gentleman has chronic prostatitis. Hopefully recording, you share it with him, he will see. Chronic prostatitis is a mild irritation, burning sensation, pain after ejaculation, pain in the place where you sit. All these are concoction of chronic prostatitis. He most likely has it. He needs to consult his urologist and take appropriate treatment. Mostly tablets.
The next question is, I think there are a lot of questions pouring in. The next question is, sir, blood in urine, is there any solution at home?
Blood and urine, drink plenty of water, make sure it flushes off. Next day, go and meet the doctor. I mean, I'll come near the mic and tell, blood in the urine, is very important. Do not ignore.
Sir, how long?
Food இருக்கு,
Yes, sir.
beetroot சாப்பிட்டேன், அதெல்லாம் கிடையாது. Blood in the urine is blood in
Has
the
to be
urine.
treated. So
It has to be treated. Do not get and demand that you need to test. You should demand your doctor. One is a CT scan, other is a scopy examination of your bladder. Demand this to your doctor.
Sir, how long can we take Tadalafil 5 mg safely?
If you look at the safety profile of Tadalafil 5 mg, it has been exceptionally safe. 15% patient complain of backache. Then because of PD5 and PD6 cross reactivity, patients may have a pupillary problem or eye problem. So if you don't have any of these things, you can take it as long as you want.
And another question.
Till it works.
Another question, sir. Sir, I have frequent stone forming problem. How to tackle this?
You need to meet a urologist and a nephrologist.
2 times
You
I
may
think
have a condition.
he has undergone surgery also. He has mentioned that.
So you may have a condition called medullary sponge kidney, which is tiny stones will form in the kidney and keeps dropping like berry. And the other condition or certain set of biochemical problem in the kidney, which makes you form stones often again. Now, generally, we say to patients that once a stone former is a stone former for life, there is a 50% probability you'll form stones within 5 years. Okay. Now, if you have medullary sponge kidney, you will definitely keep forming stones. Drink plenty of water. You will require 1 or 2 interventions in your lifetime, but it usually doesn't, cause damage to the kidney. The second is biochemical abnormalities like increase in the PTH level or something like that. So you definitely need to meet a nephrologist, get a thorough workup done, make sure there are correctable problem, and if there's a correctable problem, correct it. If you don't have a correctable problem, at least you know that you've gone through it, then that is the answer.
Yes, sir. So, 1 minute. Next question, sir. How about laser ablation in prostatitis?
Sir, prostatitis or just prostate itself?
I think they have mentioned prostatitis, probably prostate, maybe.
Okay. Now, any type of bladder neck, I presume this question has been asked by one of the urologists. Any bladder neck surgeries for prostatitis, at least if you look at the evidence and in my limited experience, have been nothing other than disaster. So, be it laser or with conventional electrocautery, any intervention with the bladder neck for prostatitis patient doesn't yield good results. So I would say avoid it. Second, for laser therapy for bladder outflow obstruction, very common now, becoming very popular. It's called HOLEP. Now, I was part of the HOLEP team in 2006 in UK. I should confess that my experience with HOLEP was nothing other than misery. We had lots of complications. Patients were grossly unhappy. The results were not as good. But having said that, the last 15 years, science has advanced and it's quite possible that we have good HOLEP machines. My advice to the professionals who want to do HOLEP is make sure you do it well and make sure you follow those patients. And for patients who are non-professional, who are willing to undergo HOLEP, just make sure that you think twice before you do it.
Next question is simple test to differentiate prostate enlargement and prostate cancer in elderly, as the symptoms are common.
Examination and PSA test. Examination PSA test will tell you the vast majority of the time.
Yeah, next is, can low dose tadalafil be given to improve peripheral blood flow?
Oh, It's a very interesting question. Uh, Answer is I don't have any knowledge of it. High dose tadalafil or even Viagra, sildenafil is given for pulmonary artery hypertension. But improve peripheral flow, I have not seen people doing it. If you are doing it, let us know. We will try for others as
Okay, sir. Thank you so much. I think these are the questions.
well.
Almost we have answered. It was a fantastic, wonderful session, sir. So
Thank
thanks to you, sir.
Thank you so much. I'm going to sign off now. It's absolute pleasure to be here.
So in fact, it was a tremendous response, sir. We had almost 360 participants at a peak. Right now we are having 313. So stably there was a
Wow.
300 people. So
Wow.
300 people have got benefited today. For the benefit of the audience, as Shar was sharing in the initial talk, this will be a continuous session. Month on month, we would be like to do it with different topics. And
Yes.
we would be very happy, sir, to have that sessions again and again.
Thank you so much, sir. I should confess that all the credit goes to Ford's team, yourself,
Thank you so
Chennai
much.
Specialty Clinic Health Foundation, who have initiated and run this system. It's a pleasure and honor to be here. And as I told, we will have a series of health awareness initiative talks once a month, second Tuesday every month. All right, sir.
Yes, sir. Thank you, sir.
Thank you so much. It's a pleasure to be here.